one of us, if God forbid we get a serious illness, and none of us know when or how. I didn't ever imagine it would be me, non-smoker, relatively good eater, worked out every day, that if it happens, God forbid, each of us is entitled and deserves the best possible care, not just of our body, but of our spirit and our soul.
The ideas that you're going to get from the Schwartz Center rounds are, you hear about other people's experiences dealing with specific patients in specific types of situations.
I have a 38-year-old woman with metastatic colon cancer who I've been treating for 1.5 years, and she really believes, though her disease is probably progressing, that God is just going to cure her. And I can't tell you how hard it is to work with her, because I know that at some point the disease is going to get her. I know that she's not probably doing with her 4 sons what I think in her heart she would really like to do.
She needs to think how she is going to carry out her responsibilities as a mother right now. And she can think of things that have to be thought about and may take her mind off the fear. What do I want to do? Should we have some videotapes or
that was exactly the conversation I had with her. And she listened very intently, and then her husband told me never to talk about it again.
Right.
But I think the issue is, well, how do you talk about it then?
It's rocky ground, and if you're going to guide someone through an illness, you really, I just don't know how to do it, basically.
I think what the rounds afford is an opportunity to help people talk about a situation where the circumstances kept them from using their humanity. The primary thing is that it validates each person who thinks about or says out loud how they feel, because they hear that other people feel the same way too. And you just don't say that to each other during the workday. You don't talk about how you're hurting.
One way to describe your work is to say, I'm a surgeon and I work at Emerson Hospital and this is what I do. But a whole other way to talk about your work is to tell stories. And in some ways, I know in my own work, I could tell the story of my professional career, not by telling my story, but by telling the stories of all those people that have impacted me in certain ways.
Story is quite simple. It was December 30th, and I received a page that there was a woman who was about 35 or 36 weeks pregnant, who'd had some bleeding at home, and that there was a concern that this woman had a serous abruption. They brought the mom to the operating room, did a stat C-section, got the baby out as fast as possible, and out emerged a limp blue baby with APGARs of 0 who did not respond to pain, made no respiratory efforts. I think you're then in a dilemma, because if in fact this mother had a full placenta abruption about 1.5 hours ago when we first got the phone call, this baby has not had any oxygen for about 1.5 hours.
We really thought there was no hope here. The baby, this was going to be, we're going to call the code at 15, and we did our best. And at 14 minutes, I felt for the heart rate, and there it was. And all of a sudden, it's a whole different story, and you get really frightened. Well, you're excited because the heart rate's there and you've got a baby, but then you're worried about, how much damage has been done and what's happened and what's going on and what did we do, was this the right choice to have done what we did?
I think what's fundamentally different is that babies are about life, and all the other Schwartz rounds cases that we had were about adults and the end of life. And when a baby's born, you kind of need to have a heart rate to be alive. So if we had never had a heart rate, this baby would have been born dead. But because we gave the baby lots of medications and got a heart rate, that means the baby was alive, and it just seems a very bizarre distinction between what life and death is. And the role that we played in that is something that I think none of us feel comfortable. That 30 seconds ago we were going to call this baby dead, and now we're calling him alive, and he has a name, and he's going to, because we gave him one more dose of epinephrine. And I just remember feeling that I knew how to do the mechanics of what I do, but I didn't understand what I was doing.
You're saying, I think, humbly, that you, well, didn't maybe know what to do or what you were doing, and of course we all get in situations where we don't know that. But I feel in one sense that this mother and this baby and the family were fortunate to have had you there. And of course you wouldn't be doing the work you do unless you were maybe destined for that, and it had really many years of experience in a lot of different areas before you came to that moment in time, which becomes almost an epiphany, a defining moment.
I had the identical case and the baby didn't die. And it was about 10 years ago, and I just happened to be visiting someone in the hospital and got dragged into a case of a patient bleeding saying, please do something, the last time this happened to me the baby died. It's been 10 years, the baby does really nothing but drool. He's totally incapacitated. But the family thinks that the doctors in the hospitals were wonderful because we listened to them, did what they wanted us to do, and they do have a baby. And I guess I had to feel good that I fulfilled their wishes, but I don't feel good that I gave her such a devastating situation.
You don't have a choice. It's very different than a terminally ill patient. You have to give someone hope.
There is something about experience, and there is something about just doing the best you can in a particular situation. And if things really are a bad outcome, just remembering you did the best you could, but you're still allowed to be upset. And there are cases, patients and families that I can't shake for months, if not years.
As the day progressed and the baby got worse, and we could see that there was a significant amount of problems, it kind of gave me a feeling of this baby's going to die, which would be horribly bad, upsetting, but I turned around and thought, but at least Mom's going to be able to see this baby. We saved this baby for Mom to hold a live, warm, heart-beating baby to say goodbye. And so leaving my shift that day was a feeling of, I did do something good in a time where it's really bad, you know? So I knew what was going to happen, and I knew what was down the future, but I also knew that it was a better thing than having to say to a mom, being a nurse, your baby is dead, would you like to hold it? And then trying so hard to make this cold, blue, stiff baby look presentable and hold and feel good.
There's a Belgian French-speaking singer that most people know called Jacques Brel, and his line on this, and I'll say it in French and translated, is "On n'oublie rien, non rien de rien, on s'habitue, c'est tout," meaning you forget nothing, know nothing at all, you just get used to it, that's it. Which is, I think, what happens. These cases are no longer in the forefront of your mind, but they're there.